WeInfuse Podcast, episode number 37. Welcome to the WeInfuse Podcast. My name is Dylan McCabe, and in every episode, we give you a behind-the-scenes look at the infusion practice, and we interview owners and key executives and thought leaders in the infusion space so that you can get the insights and tools you need to have a thriving infusion practice. Now, in this episode, I'm going to talk with our very own team members at WeInfuse, Andrew Dennis and Cecile Franca, and they are going to unpack how to transition to WeInfuse. I'm sure there are many of you out there listening that have thought, you know what, we would love that software, but we just don't know if we have the time or the energy to implement a new platform. Well, we're going to dispel some of the myths that you may have as you're thinking about how difficult it might be and talk about how it really boils down to 3 simple steps. And step 1 is once you sign up, you schedule a kickoff call. And in that kickoff call, you and the implementation team plan out a timeline with checkpoints along the way. And you get online learning and all sorts of things to prepare you for the next step. And step number 2 is in-person training. You're going to get a lot of hand-holding and really world-class customer service. And the implementation team will fly out the day ahead of your go live. The day you're there, they'll be there every step of the way and even the following day. And then step 3 is ongoing support, which is second to none. You're going to learn all about what it takes, and you're going to also hear a couple of stories. I'll call them story A, story B. Story A of when implementation went incredibly well, and we're going to talk about why. And story B, when implementation was a bumpy process, and we're going to talk about the things that practice just didn't do that made it hard for everybody. And really what it boils down to is somebody taking the leadership to bring change and to work with our team, and we will work with you and make it happen every step of the way. All right, so let's listen to this conversation with Andrew and Cecile. All right. As I mentioned, we have special guests on the show today, and it's Cecile Franca and Andrew Dennis from our very own team. So, Cecile and Andrew, thanks for taking time to be on the podcast.
Absolutely. Thanks for having us.
Yep. And what we're going to talk about today is once someone has made the big decision to say yes to WeInfuse, they know they want to save time, save money, streamline processes, and really take their infusion infusion practice to the next level. The next step is using the system, onboarding, implementation. So today we're going to address some big scary notions of what is that change going to look like? How much time will it require? What's the money involved? What does the process look like? And this is just going to be a great overview of the whole process. So you really go into it knowing, beginning with the end in mind, you know what you're getting into, and you're going to be really excited about it every step of the way. So, Andrew, I'll start with you. What's the first thing you want people to know about implementing WeInfuse?
So we work based on your schedule, right? So as soon as I get the notification from sales that the deal's been done, we set up an initial introduction and kickoff call. And no matter what, the first question I'm going to ask is, what's your timeline look like, right? So that goes right into the time aspect. How long until you want to be live with the app? So we have so then we can go ahead and get a baseline together as to how much time do we have to work with? And then I can kind of detail out the steps and how much time we're going to need for each individual step.
So the first step in the process, you schedule a kickoff call, you kind of go over the process and you discuss timeline. I think a lot of people might be thinking, oh gosh, this is going to take hours away from my staff and this and that and the other. But my thing is, well, how much time is it costing you to not use WeInfuse? And that's what I used to talk with people about. Let's just count the hours now of doing things by paper and having your nurses having a chart when they're all done, do all this stuff and all these steps. How much time is that costing you? How painful is that? How much money are you losing? Time are you losing? So to address that issue of time is so critical, but I think it's really important for people to know that this is going to save them a lot of time. And so in that kickoff call, what's a good expectation if things go well, not perfectly, but if what do you kind of coach people along to say this is a good way to do it? Are we talking 6 months, a year, 2 weeks?
Yeah, no, I always estimate around 30 to 45 days, right? I think a month is a good timeline. It's a good baseline to work with. We've seen all ends of the spectrum. Cecile and I both, I've had some clients go live within 3 or 4 days, and then I've had some that have taken 6-7 months. So it really just depends on the scope of the project, how big of a client are we working with here? And then honestly, just how willing are they to, knock out the steps of the things that we ask of them, right? Like we will never overload, anyone with too much work. So even though I say 30 days, it's not like you're going to spend 30 days focused just on WeInfuse. You still have your practice to run. Everyone's got individual jobs to do. So obviously we're mindful of that, but we do need a few hours from you, at least a week, in order to hit that at least that 30-day window.
And you guys have done a lot of implementations. Cecile, I'd like to hear your perspective, especially with your background in consulting and stuff like that before you joined the WeInfuse team and working with so many of these practices. What would you say is one of the biggest, I wouldn't call it a red flag, but one of the biggest challenges for somebody really having a smooth process to implement WeInfuse?
Yeah, that's a good question. I would say one of the keys is always finding like your one point of contact or project manager, maybe 1 to 2, depending on how many locations there are at your client, who you can go to with, hey, here are all of your options. These are all the steps that need to get done. Like, can you help me get the full team on board and ready to go? I think finding like kind of your one project champion with the client leading up to their go live is always one of the biggest keys. Because if you don't kind of have the point of contact on their side, it can be pretty difficult to get things done.
That's such a good point. If you get too many cooks in the kitchen, things don't go too smoothly.
Exactly.
I mean, that's change in any scenario. I mean, if somebody doesn't lead the charge and say, okay, I'm going to own this process and at least be the point person to see how it's going, following up, it's not going to go well. So that's great that WeInfuse leads toward that direction. And so once you have that kickoff call, you discuss timeline, you get good expectations on what they can do, the resources they have, the time they'd like to implement it in. Then what?
Paperwork. A lot of paperwork. I'm just saying exactly what I'm going to tell anyone who gets on a kickoff call with me. Because pretty much after we get the introductions, yes, we have a timeline. We may have a few project champions. We have some contacts, but we need a little bit more detail, right? So we need a staff list. We need to know who's going to be accessing the app, any vendors that you're going to be working with, your product list, vendors, pricing, as much detail as you can give us, patient information, so we can go ahead and do most of the heavy lifting and get that data imported before you go live. So the sooner we can get all of that information over, the quicker we can start working towards building out the actual location for the app, and then also getting the training tools that the team's going to need.
Gotcha. So it's going to take a little work in the beginning. You got to go uphill before you go downhill, but it's not too much uphill. It's not too much heavy lifting, but it is going to require some work up front. And I'd imagine, for the manager at an infusion center, director of operations, or whoever it is that's really leading the charge, they're thinking, how am I going to get my customer data to WeInfuse? I know that comes up all the time. So is that something where you guys are like, hey, just here's 3 videos, figure it out? Or is it more of, we're going to help you and, walk you and hold you by the hand?
Yeah, absolutely. I mean, we'll help out every step of the way, right? Like the import process, like while we can't actually pull the data for you through whatever software you're currently using to house all the patient information, we provide templates, spreadsheets, and I'll even go farther step most of the time if people don't have the time to kind of format it exactly how we need it to be. Well, it's like, just get me the raw data, whatever patient information you can, I'll do the rest, right? I'll figure it out. We'll clean it up and we'll do all that for you. But, we're always available by email, phone. I mean, Cecile and I pretty much lived on Zoom for the past year. So we're no strangers to just being available pretty much at any time.
Yeah. And I think even to add on to that, especially over the past couple of years, we've really improved both the way we do patient imports, and we've built out a lot of integrations on our side. So for our clients that have live integrations with their RCM or EHR systems, a lot of times we can pull back all of their patient info automatically and kind of have those patient profiles connected. So there have been a lot of cool developments on that side over the last few years that I think are kind of continuing to improve that process.
That's great. Yep. Connecting systems. It's you guys have put, I know because of being behind the scenes and knowing what happens at WeInfuse. I know how much energy has been put into developing connections and streamlining things and making it easy. Bottom line, making it simple. And so once you have that kickoff call, you set some timelines up, you get some forms filled out, then what happens?
So that's when we get into I say the fun part, which is training. The great thing about training is we have tons of resources, right? Like we built out an entire website dedicated to online training called WeInfuse You. It's great. We get constant good feedback from it. Series of small 10, 15, 20-minute courses that the clients can take. And then they get an actual certification built in that says once they've completed everything, to say they're WeInfuse certified, right? But not everyone wants to take that approach. Not everyone wants to sit and do online learning. Some prefer to jump on Zoom. They want a real-time demo. So the whole team, I mean, all of us, not even just Cecile and I, but we have our new teammate, Evan. We have the support team. They're more than happy to jump on and do training as well. So we have plenty of resources on that side to do real-time training. And then, of course, a big part of the implementation role is on-site travel. I know, in the past year or so, because of COVID and whatnot, it's been a little tricky. But things are starting to stabilize a bit now. And, if they want on-site training, they want us to go sit in a room with the staff for a day or two, we can make that happen.
So you guys give options. I mean, is this something that I'd assume with COVID, some people probably want the online training versus other people who might want the in-person? So once you guys schedule that let's say it's an in-person implementation and they're gonna support it with the WeInfuse You, what does that look like? I mean, are you guys there for a day, kind of trying to give them a crash course? Are you there for a few days? What do you try to cover?
Yeah, it depends on the scope. So if we're there, as a pre-visit before go live, I'll usually estimate at least one full day, if not two. Usually make the second kind of like a half day for travel time. Because I feel like one full day on site is usually enough. As long as we can get everyone that's going to be using the app involved, is usually enough time to cover most of the detail, right? The perfect example is just about a month or so ago, I was on site with a client just for training 2 weeks before their go live date. I spent 2 days, spent one at each location. And I was able to basically stand in a boardroom for 8 hours. And just the different team members would come in every hour and we would cover specifically what they're going to be doing in the app, right? So we kind of cater it to what the team needs. Like I'm more than happy if they want to do a classroom environment and we're just going to cover the app from start to finish and just absolutely cover everything. Or if we want to detail it out and just say, well, I just want to see the clinical side for the nursing team. Cool. We'll take an hour and a half, 2 hours, however long they need, and we'll cover just that.
Now let's have story time here because people love stories. And Cecile, I'd like to start with you and just share a story of when an in-person implementation went really well. And we don't need to name the infusion center, name people or whatever, but just let's share a story of when one went really well and why. And I think it'd be good for people to know that if we want to have the experience that those folks had, we really need to have our act together and we need to give a serious go at this and it needs to look a certain way.
Yeah, definitely. I think one example that comes to mind, I was on site for an implementation. This was actually during the go live week. So when we go on site for an implementation, like over the actual go live, we're usually there for around 3 days. So we get there the day before the go live, kind of make sure everything's set. The schedule's looking good for the next day and WeInfuse, inventory's loaded, kind of just make sure everything's good to go. We stay there for the day of go live. And then kind of check in the next day as well, just to make sure things are still running smoothly. And I think kind of for this particular one I'm thinking of, I got there the day before. And by the time I arrived, they had actually already entered all of their orders in WeInfuse for the entire upcoming week. They had the schedule built out all the way through the entire week, and they had finished kind of a lot of the training pieces that we had gone over previously. So they had entered all of the verification and authorization info for their orders and their upcoming patients already. So that way, when I got there and we were, the day before getting ready to get going, all they really had to focus on was getting their inventory loaded, kind of figuring out the logistics of, okay, I want my vial scanners to go here. I have, 2 laptops on my 2 laptop cards, and I'm going to roll them around. They could kind of start thinking through the details of like all of those logistics the day before they even went live. And they kind of set themselves up to just the next day hit the ground running. I think a lot of the times, if you get to a go live and there's kind of panic or people are stressed, it can be just because a lot of the information that needs to be entered in WeInfuse beforehand hasn't been entered. So every successful go live I can think of, the teams were just kind of ready to go already the day before with the info entered, and that makes the day of go really smoothly.
That's good stuff. And so how were they able to do that? Was it because they spent time in the WeInfuse U and they just had really smooth communication with you guys and did everything? I assume you guys have some sort of checklist of things they need to knock out before you get there.
Yeah, I think the key was, so yes, they went through WeInfuse U, they finished all of their training. And then we kind of give them a checklist of, okay, here are all the things you need to do before go live. You need to make sure your patients and your orders are entered. You have to make sure your appointments are on the schedule. The day before, you want to count your inventory. And then the morning of is when you're actually going to finish your treatment documentation in WeInfuse, kind of work off the schedule and go from there. So once they got through WeInfuse U, they kind of had like 2 or 3 dedicated team members that just went through, made sure all of the orders were entered, got all of their questions out about kind of the pre-treatment workflow for basically the 2 weeks leading up to the actual go live and leading up to my visit on site. And I think that kind of preparation and kind of like I was saying before, those dedicated team members who were just kind of all over it made it really easy the day of.
That's good. And, as a podcast host, I can say this because nobody can fire me. But I think the takeaway here is for the infusion center operator manager listening to this, this is on you to a large degree to make sure you're ready for the in-person training. This is on you. You don't, if you hire a personal trainer to get in shape, you're not going to show up 10 minutes late and have eaten donuts that morning. And you're not going to be wearing, blue jeans and a jacket on that you can't move in. You're also going to be following a diet plan. You're going to wear good clothes you can work out at. You're going to do your work. The trainer is going to help you to get in shape, but you're also going to do your part. And I think this is very similar, that if you don't do what's required of you and take responsibility and take action and get ready for that go live, it's going to be a more difficult process. So it's just great that you guys have so many stories of where it went well. So let's shift gears. And Andrew, I'm going to let you share a story, and we don't have to name any names. We're not here to throw stones at anybody, but let's share a real story of when it didn't go well and talk about how did it become so difficult?
Yeah, it's pretty much going to be the exact opposite of the sales example. I've been on a few that have gone south. I mean, at the end of the day, we're going to be successful eventually. It may take us a little bit longer than the targeted date, right? But especially if we're traveling out to be on site, it helps. Having someone physically there, it really is a game changer. But I would say probably the horror story that I've shared with other clients on, hey, this is how things could go wrong. I rely on the client to set up the timeline. If you say you want to go live June 1st, that's the target I'm going to put down, and that's what we're going to aim for. So in theory, I would be there on June 1st. So ideally, you want everything in place, right? You want the orders to be put in. You want your insurance verifications to be loaded. You want your patient data there, your inventory, and again, I'm there a day prior to help out with as much as I can. But the day that I show up before go live, nothing had been done. And I'd already gotten that vibe because, I kind of keep tabs on everything up till that time hits. And I can only reach out so many times to say, hey, you kind of need to do this. Otherwise, it's going to make things a little bit more stressful. Not just for me. I'm not too worried about it. I live and breathe in the app all day long, right? Like I'm fine with it. I'm here to help as much as I can. but your team's going to be stressed. That's just a reality. If I show up and I'm saying, hey, I'm here with WeInfuse, I'm here to get the app ready. I had one of the users say, what's WeInfuse? Right. That's a big red flag. That's a major red flag. If they have no idea who you are, and then you're saying, hey, well, we're trying to roll out new software, it leads to a couple of bad attitudes. People don't like you very much if you show up with no notice on their end. The end of the day, we did go live. It took us a few more weeks. We did get there. But that visit, again, the on-site visit helped. We just didn't go live when we had hoped to. But yeah, that'd probably be the worst. So I always say, like, the attitude matters and communication, right? We need to make sure that the entire team is involved and that proper expectation is set. Like, again, the date is what you set. It has no bearing on me. If you say June 30th, then it'll be June 30th. If it's June 1st, that's what you decided is best for your team. And I'm going to work to make that happen. But it goes back to what you were saying about, yes, there is some heavy lifting initially that needs to be done. Otherwise, you're not going to hit that date.
That's so good. And so for anybody listening to this, I'll call the first story Infusion Center A and the second story Infusion Center B for bad. Don't be Infusion Center B. Don't go through that experience. Don't put yourself through it or your team through it. And I think that goes with anything. I mean, bringing about any change in any organization is going to require some work, some ownership, and some preparation for things to go smoothly. And we want that. We want a smooth takeoff. We don't want to get the plane on the runway and then all of a sudden we have to sit there on the tarmac for 3 hours. No one likes that. So make sure that you and your team can have a smooth transition. And the cool thing is, what stands out to me about that, Andrew, is that you still got implemented. I mean, you guys are hanging in there. You're going to get your hands dirty with the client. You guys are going to do whatever it takes. And I know that from watching you guys operate. So once you do that, you've had the kickoff call, the paperwork's been done. They want to look like Infusion Center A and they've gone through WeInfuse you. They're ready for you when you get there. You're there the day before they go live. You're there the day they go live to make sure there's no, they don't encounter any obstacles they can't get past. And you're there the next day as well. Then what? What does support look like from that moment forward?
So I love bragging about the support response times. I know Cecile does too. We take pride in the response times because we have, obviously, anyone on the implementation side can still be used as a resource, right? We do strongly encourage that they rely on the support team, mostly because the turnaround time, response time is going to be much quicker than, Cecile, myself, Evan, anyone who's dealing with clients and trying to get, another client implemented. We're usually tied up on calls. We may be on site. Like it may not be as quick to reach us by phone or email. But the support side, I mean, they generally respond within, if you're able to get them on chat within a couple, 5 to 10 minutes with, if it's an email to support within the hour, I would say, Cecile, right? That's usually about right. Because everyone chips in with support. I mean, pretty much everyone on the team, which is great. So, and we still have clients that they prefer to have just one dedicated person, right? So I always describe, yes, I'm an implementation rep, client success as a whole, right? Client success is the umbrella that we fall under. And I'm more than happy to field emails from a client that went live 3-4 months ago, right? We don't want to make that the standard norm, obviously, but it's something that we do because it just, if they prefer that, sometimes we have to make change there.
See, I think that's key because another thing that I would be thinking in my mind, if I'm leading this charge and say, well, listen, we need WeInfuse. All right, so we know the timeline. We've addressed that. It is going to take a little time, but it's not going to take too much time, and ultimately it's going to save us a ton of time. The next thing is energy. Do I and my team have the energy to carry this out? But if I'm hearing you correctly, it really sounds like you guys are doing a lot of hand holding. You've got the WeInfuse you've got the InPerson training, and then you're really trying to maintain good response time. So you're trying to reduce the amount of energy it requires for a team to exert in this process.
Yeah, and it's only getting better because that's a perfect segue. Cecile and I have spent the last 2 or 3 months now geeking out over a implementation app that we've been using to kind of map out what the entire process looks like, right? It's an app. I don't know if I can give a shameless plug because they're a fantastic company to work with so far. But at the end, it's basically a giant workflow as where we start, starting with that initial intro kickoff call. And then we map out every step of the way what not just we're going to be doing, but the client needs to do as well. So it's a great tool for us internally to track where we are in the process, but we can also open that view up so that the client can see it as well. The client will automatically get emails triggered when they have a task due, right? Like maybe I build out the app and I get something ready for them. The app, when I mark my side as done, the client's going to automatically get an email to say, hey, this is what you need to do. Here's a list of instructions as to how to do it. Let us know when you're complete so we can go ahead and mark it as done and we can roll with the next step. So Cecile and I, we built out a really elaborate template, and it's still changing as of yesterday. I think right now we've got 19 or 20 active projects. So any client who comes on, they're going to be in that environment now. And already we've gotten feedback from clients and they love it because they're able to just go in and see where they are in the process. It actually we set the timeline in there. If anything is due or late, or if there's an issue on our end, we need more detail. We can just send them an email right from there. It's a great tool. And I know Cecile probably has this exact same sentiment as me.
No, definitely. Yeah. I think when you talk about like the energy it takes to kind of transition over to a new software, that implementations tool on our side has been helpful for us internally and for our clients. But I also think like when you talk about the amount of energy involved, I think that's why kind of go lives, the day of the go live are so exciting, because I think once you go through the process of getting the orders entered, getting the inventory loaded and getting ready for go live, usually by the end of the day, on the first day, the two kind of biggest pieces of feedback I always get, like the super tangible examples of, wow, this is going to make a big change in our process moving forward, is the WeInfuse treatment note allows our clinical users to kind of document in real time as they work through the infusion appointment. So usually on the first day, their nurses close out their notes and they always make a comment about, wow, I've closed out all of my documentation a lot sooner than I usually do. So I can finish all my end of day tasks and kind of just get out the door. And then for our inventory users, the WeInfuse kind of inventory and buy and bill system kind of allows people to predict all of the inventory they need, for the week or the next 2 weeks really quickly and really efficiently, versus having to go kind of line by line or appointment by appointment on a spreadsheet. So we always, like, even on the first day, I always get comments from our clients saying like, wow, this is going to save me so much time and this is really exciting. So it is always cool to kind of get through all of that initial work to get to go live, and then literally after the first day or two, get comments like that. So it makes the process kind of pretty exciting.
Right. I always say the first 2 weeks are the hardest, right? Like that's when you have the most work to do. But once everything's actually input and you're fully live, I mean, it's smooth sailing. It really is.
It's so good. And I know you guys won't pat yourselves on the back or promote yourselves, but I know from having been an account executive at WeInfuse and still having ties to you guys or to the company, I know that the ownership of WeInfuse regularly gets emails with positive feedback saying, that was an amazing implementation. Andrew's awesome. Cecile is awesome. This is awesome. That's awesome. Our nurses love the infusion nurses note. Like Cecile said, they're saving a ton of time. And we've even gotten group emails from nursing teams saying, we love WeInfuse. It's all worth it when you have that big picture in mind. If you can just hang in there up front, do the work up front. And it's not a long time. We're not talking about a 1 year or 6 month process. It can be done, like you said, in 30 to 45 days if things are done smoothly. So I just love that. And it ends on a good note with the infusion center. They're excited. You guys get to walk away excited too. So what else? What am I missing anything after that? What would you guys want to add to that?
I mean, I think as far as implementations go, that really is the full process. We're communicating with our clients really every step of the way. We work really closely with our support team. So even after everyone goes live, we all kind of keep tabs on, how everyone's doing, how much people are reaching out. We keep tabs on a feature request that any of our current clients send over. We actually have a meeting every Tuesday morning where we kind of discuss all of the feature requests that we've gotten from our clients as a team. And then, we're continuing to kind of build out new features every week and roll them out. So we stay in constant contact too with release notes and trainings for new features. We have a lot of exciting items on the roadmap. So once you get through implementations, there's still a lot of exciting stuff to come.
It's so good. And I can kind of compare WeInfuse, the implementation process and the ongoing customer support to another, other software platform in another vertical. It's huge name. I won't mention all this podcast, but we've used them as well in another business. And WeInfuse by far outshines them as far as the training, the implementation, and the ongoing customer support. So I'm just super proud of the WeInfuse team. And I think what anybody listening to this needs to know, simply put, there's really 3 simple steps. You have a kickoff call, develop a timeline, you start getting prepared. Step 2, you have your in-person training. And then step 3, you have ongoing support that's really just second to none. So I appreciate you guys taking the time to give an overview. And I think anybody listening to this can really go into it with should have a really good grasp of what it looks like.
Absolutely. Thanks again for having us.
Yeah, thank you.
Well, guys, I'm glad we could bring it together. I know you guys are traveling all over the United States and doing implementations via Zoom. And so thanks again for joining the show. All right, guys, that's your overview of the implementation process. You can see it's really pretty simple. Step 1 is schedule that kickoff call. Step 2 is your in-person training and implementation. And step 3 is ongoing support, which truly is second to none. I've worked with major software solutions, some of the top in the nation, and they have not had as good of training and implementation as WeInfuse. So I'm very proud to be a part of the team and want to challenge you. If you haven't done so already, if you're not using WeInfuse, you need to do yourself a favor and schedule a discovery call with one of our account executives, and you will find out how incredibly effective WeInfuse is to save you time and save you money. You'll be so glad you did. All right, guys, this is Dylan McCabe with the WeInfuse podcast, and I will catch you in the next episode.